Hi, I'm Dr. Kerry D'Ambrogio, and the purpose of this video clip is to introduce to you the concept of myofascial release. First of all, we need to talk about what is fascia. The easiest way to describe it is if you were to grab an orange and you peel away the skin of an orange, you're left with that white pith of an orange. If you cut it in half, you can sort of see the spokes of a wheel. That's sort of what it does in your body. So your body is covered by fascia from head to toe. That's the superficial fascia. And then three-dimensionally it comes inside your body and surrounds each individual muscle down to the cellular level. It wraps around the bone, becomes the periosteum. It forms a conduit for the nerves, arteries, and veins to sort of pass through. It surrounds all the organs, everything in the body from head to toe. Okay? When we take a look at fascia, it mainly runs longitudinally, but there are areas where it runs horizontally. Your pelvic floor, your respiratory diaphragm, and your thoracic inlet. These areas are extremely important because if they're restricted, it's going to affect the blood flow through the body, the venous return, the lymphatic return, as well as energy flow and neural flow. There's also a topic called the bowstring theory. This is an osteopathic concept. If you think of a bow, like the shaft of a bow and arrow, so it would represent the cervical spine, the thoracic spine, and the lumbar spine. The string in front of it would represent the front of the body. This would be the fascia around the organs, around the muscles in the chest wall. So it's very important that we can come in here and release these areas, and this would help to relax the spine. Jean-Pierre Barrel does this very well with his visceral manipulation series. When we look at fascia, let's talk about the molecular structure. Fascia is basically composed of three things: collagen, elastin, and ground substance. When we look at collagen, it's a protein. It's shaped like a DNA, like a triple helix. What that means is that it's extremely strong, it's extremely durable, but it can only stretch about 5%, which is good. It gives a strong backbone. We also have something called elastin. When you think of elastin, think of an elastic band. It can stretch up to about 150% its original length. It's also a protein. We also have ground substance, which is a liquidy gel. It's got hyaluronic acid and it's got protoglycans. So the protoglycans allows for shock absorption, and the hyaluronic acid allows things to glide past each other. The next question we got to ask ourselves is, what happens to fascia when it gets injured? If you've been in a car wreck, you've had a fall. Let's say I fell down and I landed on my right hip. What happens? Well, interesting enough is that your body is going to lay down more collagen, not the flexible elastin. It makes sense because it's trying to protect that area. When you look at collagen, we're going to show you this in the course, collagen is very organized, so very linear. And when we get new tissues being laid down, they go in all sorts of different directions and develop scar tissue. The ground substance also changes. It changes from a liquidy gel into this concrete. So for example, let's say I had surgery here on my gallbladder. So afterwards it could create a fascial scar, and you can see how it's going to change my posture and bring my shoulder forwards. So when I try to move my arm, you're going to see that it's going to limit that. Typically most therapists, if someone came in with a shoulder problem, would start to work on the shoulder. That's why we have to be thorough in our evaluations to find out this is where it's coming from and do a fascia release in that area. Now the next question we have to ask is, what causes fascial tension? Because this is something that you're going to ask your patients about. So what causes it is trauma. If she had a sports injury, a fall, maybe skiing or skating or off horses are typical things, or surgery, right? Mental stress can create this, or sometimes just body position if you're doing, repetitive tasks again and again. Now, if a patient comes to you, we need to decide, well, how do we know this patient has fascial tension, and how do we know that they're going to respond to myofascial release? Because we know that myofascial release is probably one of the best ways to release scar tissue. And this scar tissue could be in the muscles, right? It could be around the bones or the joints. It could be around the organs. It could be around the meninges, like the dural tube, or the vital structures, like nerves, arteries, veins, and lymphatic. So on the course, we're going to teach you to evaluate using subjective evaluation. Was there a mechanism of injury? Is this acute or chronic? Right? We're looking for trauma. Did they have surgery, a car wreck, all the things that we talked about? What stage of healing are they in? The next thing we look at is objective evaluation. And we talked about this in the introductory video. We talk about ARTS, A-R-T-S. The A stands for asymmetry. So if we look at Angie and we look at her pelvis, I can see that her right iliac crest is a little bit higher. If I put my thumbs on the inferior aspect of the ASIS, I'm looking for rotations. And what I notice is that her right ilium is rotated forwards a little bit. She's got an anterior rotation. I could also place my thumbs on the medial aspect of the ASIS and my index finger in the belly button, and I'm looking for a flare. A flare is in the transverse plane. She has a little bit of an out flare over here. I could also evaluate the pubic tubercles. So we know that when we look at posture, the more asymmetrical you are, we know that this is going to affect your range of motion, your functional range. But the key thing is we don't know why it's there. Her postural asymmetries could be due to muscle spasm, fascial tension, joint restrictions, fluid. Maybe it's due to some kind of stress, mental stress. We don't know. So we have to continue with our evaluation. So the next thing we do is R. That's restriction in motion. So I would put my hand on this area that I found was in dysfunction, and I could evaluate range of motion. Hip abduction, adduction, straight leg raise. I could also evaluate flexion. Okay, I could evaluate internal, external rotation, or extension. So all these different movements. What I'm looking for is what does she like to do and what doesn't she like to do. And also, what's the nature of the barrier? If I lift this up and I'm feeling sort of a firm end feel, that's telling me that there could be muscle spasm or there could be fascial tension. If I don't find any tenderness there, then I know that it's going to be more fascial restrictions. So what I have to do is we have to go on to the next level of evaluation, which is the T. So tension tests, I can come in here and I can evaluate her iliosacral joint through a spring test. I can do a spring test through the pubic area as well as the hip. So she may have some tension there. Fascial tension can create tension in the joints. I also want to feel tissue texture changes, and I notice that she has a little bit more tension on this side. I can then palpate for tenderness. If she had a large amount of tenderness in her body, I'd want to use position release therapy, but I'm not finding that. So what we have to do is go on to the S part, the special tests. And one of the special tests we're going to teach you in this course is a fascial glide test. So I would place my hands on the area of concern, which would be her pelvis. And what I'm going to do here is I'm going to gently sink my hands in, and I'm going to evaluate the movement from left to right. What I'm looking for is, does she move one direction really easy? And does another direction, is it really stiff? And I'm looking in this plane, and I can also move superior and inferior, and I can check diagonally in each direction, and I can also check clockwise and counterclockwise. I can also ask her to roll in her stomach, and I can do the same test posteriorly, because fascially she could be restricted anteriorly or posteriorly. Hands back here, and I can evaluate the fascial tension to the right, to the left, superior, inferior, diagonally to the left and to the right, and also rotation. So what I'm looking for is, does she move easy in one direction and is she restricted in the other direction? The next test I can do in this position is the pelvic floor. So I can place my thumbs on the ischial tuberosity, so that's where they are, and there's the coccyx. I want to place my thumb so it's halfway between both those points. I'm going to have you take a deep breath in for me. When she breathes in, what should happen is the respiratory diaphragm should come down, but also the pelvic floor should also come down. So breathe in again for me. So what I'm noticing is her left side actually comes down easier than the right. So she does have a little bit of a dysfunction here. Let's have you roll on your back. So now what we're going to do is just talk about, well, how will we do a myofascial technique? We've already done the evaluation, and we have to decide where are we going to do the technique. And how we do this is that it's from our evaluation. Did we find more tension in the front? Was there more tension in the back? If there was more tension in the front, that's where we're going to do the release. If there was more tension in the back, we're going to roll on her stomach and do the release there. If she had an equal amount of tension in the front and the back, I would place my hands front and back. I'd probably be in a sitting position, and I could do the fascia release like that. Or I may choose to do the release on the inferior part. So let's just give you an example. Let's pretend that her tension was mostly in the front. Step number one in a fascia release is I'm going to gently sink my hands into the first barrier. I can do one of three types of techniques. I can do a listening technique. A listening technique is where you sink your hands in and you just follow the tissues. It takes a little bit of practice. The other two techniques are more mechanical. So I can sink in and I can do a direct technique, meaning I'm going to evaluate and find out where she doesn't like to go and take her there on 1, 2, or 3 planes. I typically like 1 or 2 planes. 3 planes tends to bind things up too much. Or I can do an indirect technique. I can take her on 1, 2, or 3 planes into where she likes to go. So let's do an indirect. So I gently compress in, and I'm evaluating, and she tends to like to come this direction to her right, and she likes to come down, and I can evaluate other things. I'm just going to work on 2 planes. I'm going to come directly across and down. So what I've done here is I've created what we call a fulcrum. And her body is going to release around that. This is a myofascial technique affecting the superficial fascia as well as the deep fascia around the muscle system here. I'm going to hold this until I feel a release. So you might ask, well, when is the release? How do you know? Well, I'm going to be feeling for heat. Heat starts to build up under my hands. I might feel some pulsation or vibration. Sometimes I can feel a sense of movement. So I'm going to hold it there until all of those signs and symptoms kind of release a little bit. I'll also feel, once the release has taken place, a sense of lengthening. I'll feel that the body tends to soften underneath my hands. And also she might take a sigh. A lot of times when the release has taken place, they'll go, ah. And also under my hands, I might feel that respiration comes in there. The area begins to swell. So as this begins to release, usually takes maybe a minute, sometimes 2 or 3 if it's more severe. Now in the class, we're going to teach you other techniques to speed this up, called body positioning and release enhancement techniques. And when we're finished, we remove our hands slowly. And remember, anytime we do a technique, whether it's this or any of the other techniques, we always reevaluate. So we would reevaluate each of the bears to see if there's an improvement. We'd evaluate anteriorly, posteriorly, as well as inferiorly. I would go back to the arts. I would see if there's any change in the symmetry of the pelvis, the ASIS, the flares, the pubic tubercle. I could go back and reevaluate the range of motion. Go back and evaluate the tension tests, on each of these structures. She should have less tissue texture changes, and if there was a little bit of tenderness, that should be much better after this. Now, who can this benefit? This is great for your athletes, or anyone who's had sports injuries or car accidents or surgery. This is a great technique to do on any age. I've used this on young children, in their first year of life. My oldest patient was 99 years old. If they have a sprain, strain type injury, it works very well. At the D'Ambrogio Institute, we're going to offer myofascial release as 2 3-day courses. Myofascial release for the lower quadrant. What we're going to look at here is everything below the diaphragm. So the lower ribs, the abdominal organs in through here, the fascia around that. We're going to take a look at the pelvic region, the sacrum, the hip, all through the lower legs, the knee, the ankle, and feet on both sides. And for the upper quadrant, it's everything above the diaphragm. So the whole chest region, the shoulder, elbow, wrist, and hand. We're going to look at the spine, and we're going to look at the cranium. When we teach you techniques, we're going to teach you what you saw earlier is just a simple myofascial release. But we're going to teach you how you can release fascia around the bone, how to release it around a joint, how to free up fascia around the nerve, artery, vein, and lymphatic, around the organs, as well as the dural tube. When we teach you these classes, we're going to teach you the basic concepts of myofascial release and the principles. We're going to give you a lot of anatomy and biomechanics of the areas we're going to work with. We're going to teach you how to do arts, the asymmetry, the restriction and rein, the tension tests, the texture changes, the tension, the special tests. So you will know whether or not you have to do myofascial release. We're going to teach you how to perform fascial release on each of those body regions. The muscles, right? The joints, the bones, the meninges, right? The organs, all these different areas. We're going to give you lots of hands-on. We're going to give you, a nice manual. It's going to have highly illustrated pictures to show you all these different techniques. We're also going to put together a review DVD. So after you've taken the course, you can go to the website and be able to watch the DVD just to help you, augment your learning. CEUs are going to be provided for this class. And I tend to do lots of review. So if you're in the class, each day we review the material before. So hopefully we'll see you at one of our classes.